Assalamu alaikum, the communication day. First scenario, we have Mr. George, 55 years old gentleman. He's lifelong smoker. His CT scan showed metastatic renal cell cancer. The task is to sit with Mr. George, break the bad news, and advise about possible management plan. If you're ready, Dr. Tanvir, you can start.
Yeah, yes, Dr. Wasim, I can start now.
Okay, here you
Uh, Hello, sir. I am Dr. Ali, one of the doctors in this clinic today. Can I confirm you are Mr. George, 55 years old?
Yes.
Okay. Mr. George, today I came here to discuss regarding your health condition. Is it okay for you?
I think the voice, just if you are using headphone, just if you can use.
Yes, I already using that phone.
Yeah, now it's okay. If you.
Okay. So, Mr. George, today I came here to discuss regarding your health condition. Is it okay for you?
Yeah.
Okay. So first of all, I want to know that you want to keep anybody in our meeting to support you.
No, I'm okay. Thank you, doctor.
Welcome. Can you tell me that how much you know about your health condition, Mr. George?
Okay, doctor. So recently I feel like quite tired, and I keep coming to my GP on and off, and he suddenly asked me to come here to the hospital, and in the hospital they asked me to do the CT scan, and I'm here to have the results.
I am appreciating your concern, Mr. George. Yes, as you know that you have some health-related issue, you went to your GP, and we did some scanning of your tummy. And the scanning result now with me, and that is actually as not good as we hope.
So, what do you mean by that?
Yes, no, Mr. John, I'm feeling afraid and very sorry to tell you that from the what our scanning, what we found, we are calling is renal cell carcinoma. Don't bother the medical term. It's like it means that cancer of your kidney.
Sorry, excuse me, doctor. I can't take everything in at the moment. Just let me know. I was come and go to the GB asking because I am quite tired. That's it. And now you are talking to me that I have cancer. This is what you want to say.
Yes, Mr. George, I'm really sorry to tell you about the news. Actually, from our note, we found that you are a lifelong smoker. So you know that the smoking is lifelong smoking, and heavy smoking is one of the cause which can develop the cancer. And what our that scanning result shows that is cancer in your kidney is one of the possibility that it's developed from your any other parts of your organ. I mean,
Doctor, sorry, excuse me.
yes.
It's not my habit just to cut off the things, but I'm not quite sure that you are sure about the intent of what you are saying. You may talking to another George, not me. Are you sure you are
Yes,
talking to me, George?
Yes, Mr. George, I appreciate your concern. Yes, I understand it's a very difficult situation for you, but I want to assure you that usually in that when we saw this type of the issue, I mean, this type of the cancer issue, we are actually doing double check to confirm it. And we already did double check, and I'm sorry to tell you that it's your result.
Oh, I
I
never.
will give you some, I understand, I will give you some tissue and water, please. And you want to, if you want to postpone our meeting, so we can better postpone it, or you want to continue today?
I'm quite shocked. I never expect that at all. That's this is the issue. I never expect this.
I'm really sorry to tell you that please take my full sympathy. You could take little water, and if you want, we can postpone our meeting. Is it okay for you?
No, it's okay. You can continue with that, but I can't absorb all this information at the moment.
Yes.
I think this is the fault of my GP. I was quite ill over the past few months, and I've been
Mm-hmm.
come in and out of the GP clinic,
Mm-hmm.
and he keeps saying that I have problem with my hemoglobin levels, and he keeps
Mm-hmm.
saying things which I think he
Mm-hmm.
misdiagnosed me.
Mm-hmm.
I think this is the issue.
Mm-hmm. I'm really sorry actually what happened with this, but Mr. George, I want to tell you actually, sometimes initially cancer not detected, like as you feel tiredness and your hemoglobin become low. Actually, this type of the issue can happen for the variety step of the result. I was not present in that situation, but as for my experience, I just want to tell you that initially, most of the times, it can, like different situation can present this type of the tiredness. So I think that your GP is treated to you like as a other thinking of the other issues. But I was not present actually in that moment. Just from my experience, I just told you.
Okay. Continue, doctor.
Yeah. Okay. So, Mr. George, so now actually what I said to you that it's actually, I'm really sorry to tell you that it's showing that it is spreading to your kidney. So there's the possibility from the origin of the cancer from any other part. As you are lifelong smoker, so there is a one possibility it is spread from your lungs. Are you with me?
Sorry, I didn't hear that again, please.
Yes. So actually, this your scanning results showing that it's that spreading your cancer to your kidney. So there is a possibility, as in our note, it's showing that you are lifelong smoker. So there is a possibility it can arise from any other organ, and then there is a possibility maybe it's even in the lung. Are you with me?
Are you saying that I'm dying in a nice way?
I'm really sorry to tell you that actually I did not mean actually these things. I just want to tell you that this is actually spreading cancer to your kidney. So in that condition, actually, we need to do some other more test and some other more investigation and some imaging scanning to rule out actually from where the cancer originated. Are you getting my point?
Okay, so I understand that you are not quite sure. Is that what do you mean that you are not quite sure what is this cancer?
I'm sorry to tell you that it's sure that it's cancer in the kidney, but I just we need to do some other more investigation and more scanning to know that actually that from where it's originated and is there any spread except your kidney is spread to any other part. And
2 minutes
we need to
left.
see actually depth of the cancer. So in that situation, actually, we need to involve our cancer doctor, specialist nurse. We are calling this Macmillan nurse. Are you with me?
Yes,
I just want to ask you with whom you are living in your house.
I live with my family.
Okay, is that proper support in your house?
Yeah, I think so.
Okay, okay. So do you need any financial support?
No, just I need to absorb what you are saying.
Okay. I just want to tell you that are you nominated anybody in case of your health condition if deteriorate anybody take any decision
Yeah,
instead
my
of you?
kids. I have two kids, and I have my wife as well. I am the
Okay,
one
lovely.
who's responsible about them.
Mhm. I just want to ask you some other more question, if you don't mind. Do you smoke?
Sorry?
Do you smoke?
Yeah, yeah, I've been smoking since I was 14.
Mhm. So I just want to tell you, as we found from your note that you are long-term smoker and still you are smoking. So better to, in this condition, to stop the smoking. If you want, we can send to a smoking cessation clinic because it will making more problem of your health.
So is it at any benefit if I stop smoking at the moment? It's already I have cancer and it was meds and what the benefit? What I will gain if I stop smoking?
Yes, I highly appreciate your concern. Actually, in this situation, if you not stop the smoking, it will be more worse with the time. So we need to actually, for the prevention of the more worsening condition, actually to stop. Are you with me?
Yeah, yes, I understand.
Okay,
What
time
you're
is
doing
up.
for living? Just 1 minute.
Okay, okay. Go ahead.
What
Go
you're
ahead.
doing for living, Mr. George?
I'm a driver, taxi driver.
Okay, how much it's affecting your daily life and your job life?
I'm okay with my life and job.
Okay, so if you feel any discomfort during your driving, so you can let us inform and you may need to stop your driving. Is it okay with you?
Not okay. Not okay.
Okay,
How I can take care about my family. It's okay.
okay, yes, in that situation, we'll involve our social care worker and they can help you and in this regards.
Okay, thank you.
Is it?
Okay.
I'll give you some leaflet and brochure, Mr. George. You can read more about it and we'll give our contact number and you can contact us anytime if you feel any type of discomfort or any health related issue. Is it okay for you?
Okay, thank you.
Okay. Thank you, Dr. Tanvir. Thank you, Dr. Tanvir. And like we can hear, well done. Let's hear Dr. Mayada comment.
Okay. So it wasn't an easy scenario, I know.
Mm-hmm.
But this is one of the scenarios come actually in the exam, one of the breaking bad news things. Let's start with the things that you are done good first. Uh, I think you offer help, you ask the patient early that if he need help or someone to discuss with, and then you start to identify what the patient knows about the situation, the background, what is the background of the patient, about why we are here today, what is the meeting agenda. So that was you explored that in a good way. uh, Also you end up by asking about his social history and how this and if there is anyone depend on him. So this, I think, the way you structured your communication was okay. Early, but there's some areas need to improvement. The first thing that this patient is concern, the first concern of the patient, he's now just giving the concern in front of each other. The first concern that you are not quite sure that if this my information. If you give the shock for the patient and give him a time to absorb the shock and explore his concerns, let him talk. Let the patient talk. You don't. I feel like you are hurried to complete a task. So communication, it's not about completing task. It's about how you are dealing with this man and how let him to be satisfied. The other thing that you was trying to, I feel like you are judging judge him about smoking in the first. that you was smoking for a long time, and this is the risk factor for this type of cancer, which I dislike, because in this case, in this scenario, this patient in the first, he's denial. He denied that he have a cancer in the first place, and you are just pushing him that you feel you show him that you are judged by your smoking habits. That's why you have this cancer. So I think it's not the area, or it's not the correct time to say this. You can say in the end of the on this scenario, like there is many risk factor to have this type of cancers, and you need some lifestyle modifications. If you can modify this, so it will be something you advise about smoking, but don't say it like directly, this is a risk factor, that's why you have this cancer at the moment, because he's shocked. We are talking about shocked patient now. He's shocked. He has a concern regarding the GB. I think you did it well, that you wasn't there, but I think I will stand for the GB a little bit more. Like the symptoms you come with being unwell. These symptoms is more common for many things, and I think when he concerned, he just referred you to the hospital, but it's still. I am not there, as you said. I'm not there to understand what's going on behind this scenario. I think this is the most of the thing. The good thing that you are asking, offer another meeting with him to discuss if there is anything else, or and I think this done good. Yeah.
Thank you,
Yeah.
Dr. Maida, for your feedback. Actually, I just because why I smoking issue I told her because she was surprised how that cancer developed and why not GP told him and why not investigate before. And the main
Yeah.
concern how suddenly it became cancer. So as it's
Yeah,
mentioned in the scenario, so as a possibility, I just told
Yeah.
her
yeah, yeah.
that
Yeah,
told him.
it's okay to give a clue, but it's not judgmental. You are not here to judge him because of your smoking. You are having now a cancer. Okay, it will irritate him and it will irritate the examiner. This is what I understood also from other scenarios. If you are talking about something happened because of some triggers, uh, how you know this is the first trigger? It might be something else, and you don't know here also is it lung cancer, right, Dr. Tanvir? I agree with
Yes,
Dr.
yes, yes. I just
Mayada.
give as a possibility because as it's metastatic renal cell carcinoma, supposed to be originated from other place.
Yeah, you
So
don't know
that's
from
why
where.
for
That's
as they explain, yes, exactly.
yes, exactly. So it's a tricky scenario. Don't say it's from the lung, possibly. No, we don't know. It's if it's written there, you can say. If not, don't say it unless he asked you where is the origin or the original cancer. If you are not sure, you can say it might be something else. We are not sure about it, as you said. But don't be judgmental because of your smoking. You mostly have the cancer in the lung. You don't know, maybe from other areas. I agree with Dr. Maida in this point. So try to be diplomatic in your answer and don't advise the smoking cessation now. As she said, Dr. Maida, as a surrogate, she told you why, Dr. Alisa, because I I gonna die. So what does matter for you if I stop or not? So I prefer not to advise totally, and it might deduct a big mark in this issue. If you advise about smoking cessation and the patient is having already metastatic cancer. So I prefer not to do it. Okay,
But
Dr. Tanvi? Yeah.
Dr. Basim, in palliative care, I think we have to just advise about to stop smoking, decrease alcohol intake, and all these things, because the care maybe it will continue for very long time. We don't know, maybe for years, for months, and all. So
You know,
if it
if
is
the
end of life care, it is not advisable. But in palliative care, we have to. Yeah, this is a palliative case. Yeah,
yeah, this is a palliative, and I'm wondering if
Ex-
Dr. Tanvir didn't talk about palliative at all.
but in
no,
palliative care,
actually,
I
yes,
think we have to
yes.
advise for stop smoking, decrease alcohol intake, and all these things because the care will continue for a long time. It can be for years also.
Yes, actually, I have some point here regarding that why we need to stop smoking. Please, as doctor said here, that he is not like in the stage of the life. So if we not stop the smoking, it will more deteriorate his condition. You understand my point. That's why I said that better to stop the
Yeah,
smoking.
I
Yes, because he is
Find the
not
understand.
in
way.
the
Find
stage,
the way.
not like, yes.
Find
And
the way to
another thing
say
is,
it.
Sorry, Dr. Maida, what are you saying?
I'm telling, find the way to say it. Not here, not in the beginning, like
Yeah,
because
maybe
you're
yeah.
smoking and this thing. If you want to advise, try to find the way. If I am not accepting the diagnosis in the first place, I'm not accepting the diagnosis in the first place. I think if you offer this like still we need to talk to each other and with another colleagues and MDT and everything because we have a lot of advice to give you and we will help you during this period. So you can touch the things, but try to find way to put it.
Mm-hmm.
Because he's in the first place, this patient is denial. He's out of it. So
Yeah,
any advice you are giving, anything you are giving, it's not working at the moment. It's not working.
yeah,
So
I
you need to
agree.
find the way.
Yeah, I agree to raise this issue. If he asked you, what do you think, doctor, this cancer related to? You can say, I noticed that in your note that you are a smoker for a long time, and the smoking in the medicine always as a trigger for cancer. But don't tell him, as you said, Dr. Tavir, yeah, because of your smoking, you mostly have a cancer lung or lung cancer. But again, as Dr. Maeda said, at the end, if he asks you about the reason, you can say, because of smoking, and I am here to say, please, I need from you to stop smoking because it might harm your health again, particularly your condition, in this way.
You
And
can say it
again,
Okay?
by another way يعني think,
yes, be
smoking
diplomatic. Yeah.
will help in your palliative care
Mm.
will help in your quality of life after you diagnose cancer. يعني it makes
Dr.
sense to
Basil?
advise about smoking.
Okay, Dr. Ahmed, yes, I agree for that.
Mm.
So in another way, you can say it, especially with palliative care management. Yeah, go ahead, Dr. Maha.
No, this is Dr. Selma. I think
Okay, go ahead, Dr. Sam.
I think Dr. Tanvir, in the end, he asked again, "Do you smoke?" Right?
Yes.
Or
Yeah,
I heard
yes,
it.
yes.
and
I
it's
asked
written there.
now
Yeah.
currently smoking. As I said that, yes, you are currently still smoking in that, like in that form I asked.
Okay, Dr.
Mm-hmm.
Tanvir. I think what is Dr. Mayada and Dr. Basim meant that you should talk to him about smoking risk. This is very important because in the scenario also they wrote that he is a smoker, right? But not in the beginning when the patient is in denial, or even if he is not in denial, not in the judgment way that because
Yeah.
of you smoking you brought to yourself this musiba, as Dr.
Yes.
Salah say. Don't say
Yes,
that
exactly.
because of your smoking you brought to yourself this problem, you put yourself in this situation because you are a smoker. How can you feel when I am putting this sentence like this,
Yeah.
Dr. Tanvir? How can you feel? This is the meaning of what you said. Because you are a smoker, you brought to yourself this problem. You put
Yeah.
yourself in this situation. This is a judgment. So you can just delay it to the end and ask him as you did. Do you smoke, sir?
Mm-hmm.
Yes. So I believe that smoking is very harmful in your health, and especially when you are having a cancer.
Mm-hmm.
That's why I recommend you to stop smoking. Just very easy.
Yes. I agree in this way. Again, we are agree all of us not to judge on smoking and the cancer already diagnosed with. It's like you are shocking him twice. Now you have cancer and the cancer because of your smoking. Yes, it is because, but we are not saying in this way. We are just breaking bad news. And if he asks, do you think, doctor, the cause of this cancer? I might relate it to the smoking, but it might be something else. It might be familial or something occupational to his job. We don't know. And by the way, for the job, why you are stopping smoking? Sorry, stopping his driving. He said, I am okay, I can drive. How you can judge on his driving? If he said I can drive, doctor, so why you stop him driving? This is another
No, I
question.
did not actually stop him. I said,
Yeah.
if you feel any problem during your driving, which can impair your driving, so you can stop that time. It's not like DVLA, you go to DVLA, not like that way. Like any physical condition, even due to the high body temperature, it can affect
Hmm.
over my driving. We can tell in that situation, okay, if you
Okay,
feel
so you
more
give him as
fever,
advice.
yes,
Maybe
yes,
I
yes,
misunderstood
not
like you
about
are stopping. Okay.
DVLA, its restriction, not like
Yeah,
that
yeah,
way.
yeah. Okay,
Like,
okay, okay.
yes, yes.
Yeah, it's as advice. Okay. The third thing also to ask for the expectation, as Dr. Rashid wrote in the comment, yes, it's better to ask the expectation. The invitation here is perfect because he's going to receive a shocking news. I believe Dr. Mayada was like Mr. George, really. I believe like she was crying and she's acting properly
Good
and
actor.
she needs, yeah, she's good actress. I believe she needs some tissue to cry in real. I I think so, Dr. Mayada, mashallah. You did the scenario perfect.
Thank you.
Till the end, by the way, you are talking like you are Mr. George. Okay, this is my comments. Anyone has comments for Dr. Tanvir? But in general, you did perfect, Dr. Tanvir. Apart from judgmental, don't judge on the things. Don't invent this is cancer lung if not written. Try to follow the scenario strictly. If written cancer in the kidney and no primary, so you don't know what is the primary so far. Okay. If she asks, you can say, as you said, we can do another scan just to pick up the primary or the organ which is sending this spreading. Clear?
Dr. Basim, I have a question.
Yeah. Yeah, sure.
Yes, what I understand from the scenario is that the patient
Yeah.
has primary RCC. Okay, it is primary and metastatic. Yani it is
No, no,
renal cancer and it is metastatic.
Well,
It is not.
yes.
It
Another
is.
thing
It
to
is
recognize.
yes. It is
Renal
no,
cell
no,
RCC
carcinoma
metastatic
metastatic.
renal cell.
with MET, right? Renal cell
Yes,
carcinoma with
yes.
MET.
RCC with meds. Yes,
Ah,
Yes.
okay, that's the renal cell metastatized away from the
yes,
lung
yes,
or from
yes.
the
Yes.
That's what
kidney.
I
Okay.
understand really.
Yes, me
I
also.
I didn't understand it like this. Okay, let's ask Dr. Mayada, what is the primary here? Is it renal cell carcinoma and already
Yeah,
metastasized outside?
it's renal
Uh-huh.
cell cancer with meds.
Okay. Yeah, okay.
And when she said to him that he has a hemoglobin issue and all these things, I expected
Yeah.
that it is polycythemia. It is not a low hemoglobin.
And polycythemia due to erythropoietin, you mean, right? Yeah,
Yes,
high
yes,
erythropoietin.
yes, yes.
Secondary. Okay. And yes, it's so deep, mashallah, you're thinking, Dr. Maha. I didn't
It
think
is not
all
so.
the
It is not so deep because from the beginning I understood it is like
No, I
RCC and it is
didn't.
metastasizing.
Yeah, it's good thinking, but don't try to go deep to this level because he will not ask you all these things. Really,
Yes, yes.
but it's good to explain it in this way. By the way, it's perfect explanation in clinical judgment way. Okay,
Thank you.
but yeah, but in the communication, you don't need to do all these things. Just stick to the scenario. By the way, 10 minutes will be fair enough and more than enough to talk about palliative as a task in this scenario. So the primary or the first task is breaking bad news. The second one is palliative therapy. As Dr. Tanvir said, we can invite a group of doctors. They will sit with you to put a proper management plan. One of them, lung doctor, kidney doctor, and possibly the Macmillan nurse. And we will sit with you in another meeting to know what exactly you can receive.
But
because you
we
don't know
cannot
what.
say a Macmillan nurse. Yes, we have to
No,
explain
no.
it like
In
a special nurse or
okay, specialty is called Macmillan nurse
yes,
like this.
yes,
Yeah.
yes, yes.
Okay, and you can prepare him for possibly what's called palliative therapy, and this is the group. And the palliative therapy might be if you have time, but if he give you short time to explain the palliative, so don't go deep. I mean, if you have time to speak about the possible palliative, what can be the possible palliative here? Maybe chemotherapy, maybe radiotherapy, maybe surgery. So all this under the term of palliative therapy, but be sure that we'll be with you in this journey. You will try to avoid any suffering because we know you will suffer because of the pain and blah blah blah. So we will be sure that you will not suffer from these things. Yeah.
Dr.
Who wants to
Bassem,
talk? Yes.
I have a question. Dr. Tanvir started to ask about something. I think I get something he said. Maybe Dr. Mayada did not get it, but he did not continue with it. Dr. Tanvir, please correct me if I am wrong. You asked if the patient nominated anyone in his behalf to take a decision about his health, right?
Yes,
But he
yes.
didn't
Yes, yes,
understand.
yes. I asked that. Yes.
Yeah, I was thinking like you, the same. In every scenario of cancer, we should ask this question. Do you agree with this, Dr. Basim, or no?
I think this is quite early. This is early to
Mm,
to say this. It's really early. Because if you put yourself in the real life, in a real patient, talking to him, and he's in the first place, he wasn't agreed that he's having cancer. I think I will consider
mhm.
will be there for that. But I will tell him that we have a lot of meetings. We'll have a lot of meetings. We'll not let you go through this all by your own. We will help you, and we'll make sure that we did a good thing, a good decision at a good time. So we'll do this like next week or something nearby, but
Yes.
not now.
Yes, exactly. I
But
agree.
here actually one point, like if there is a metastatic cancer, so
I
that
mean,
like I feel,
if you
hello?
put yourself in the shoes of the patient, if you are him,
Yes.
all this is a lot of information to absorb, a
Mhm,
lot of
yes.
information. So you need to give your patient time, and then you can sit with him again next time
Yes.
to say what it is, because in the exam they want you they want to know how you are dealing in real
Yeah.
life with the patient.
Yes.
This is a lot of information for me to be given now.
Yeah. The other
Okay.
thing,
Yeah, thank you for answering. Thank you.
Yeah,
most
So we agree just explain the disease only and the management. Just
yes, yes,
And it
okay.
depends on
So
the
so
candidate, in fact. If the candidate is already prepared and he's asking, and the scenario show that he's okay to absorb all this information, and you check his understanding and he's with you, you can go further. I think it's according to the situation. It's not on and off. It's according to the situation, and it's according to the scenario and the candidate and how it works. It
okay,
yes,
depends.
one thing actually, when there is any advanced disease, like here metastatic carcinoma, it's
Mhm.
obviously it's an advanced disease, patient going for the palliative care. So anytime patient's condition can be deteriorated, maybe that time patient will be not compliant. So at that time, I feel we need to ask politely that do you nominated anybody, like if
yes,
like anybody take decision if your condition, I'm sorry to say you, if your condition deteriorated, because in the advanced disease, especially metastatic disease, we need to ask about that advanced directive, any living wish, anything with him or not.
yes. I agree too, but I think in the next meeting, much better because this patient now is shocked and frustrated by this news, so he's not expecting all the things. I prefer to ask him in the next meeting because you have two tasks now. As I said, you have to fulfill this task. First one, breaking bad news, and he will react as Dr. Mayada did. It will take at least 4 to 5 minutes. By the way, if she is reacting like this, just support her, give her tissue and water, but never tell her we can postpone this meeting. If she said, yes, doctor, I think I cannot continue this meeting now, you will be in trouble. So you waste 5 minutes without talking about palliative. Don't mention it at all. This is my opinion. Suppose not to say, yes, doctor, I am not fine. But if she said, no, doctor, I am not feeling well, I cannot go ahead with this scenario, or sorry, I cannot go ahead with this meeting now. So it will be trouble for you. Then the palliative therapy, then the social, who's living, and again, as always, advice, no need for financial support. Do you need any support? Or if you need, or any a family member needs support, it's not a matter of financial. In UK, they are all of them supported financially. Everyone living there have his financial support. So it's a matter of other support, social support, not financial support. It's not preferred to say about do you need any financial support. Okay, clear for all?
Yes, yes, yes. Thank you,
Yeah,
Dr.
we
Basim.
can. Yeah, thank you, most welcome, doctor. You can post your scenario, please.
Okay,
Dr.
I'm
Bisma,
sharing in the group. I'm sharing in
yes,
the
I
group.
don't know if he offer someone will drive here home, because this is important
uh,
and very bad
it's
news.
it's one of the like cosmetic things, like someone to drive you home. How are you feeling now? All the things. It's not the main task, but it's okay. You can say it, of course.
But it's important. Sorry, it's important. Yeah, I think it's important to ask.
Really? So it's
Yeah,
okay.
because here, this is what I'm seeing here. Uh, when you break bad news, you need to offer something. You need to offer help with these things.
Okay, good.
Yeah, so it's like,
تقدر أعرف
yeah.
من
Yes, it's a matter of welfare actually.
Mm.
Like
تقدر
after
أعرف
Yeah,
breaking bad news,
welfare,
you can
good,
offer.
good point. But if you miss it, it will not harm your mark. This is my
Yes,
point. Yeah,
not
it's
much harm.
important.
Yes, yes.
Yeah, it's
It's like
important.
nice
Yeah,
to tell. It's not like must to tell.
yeah, it's
Like
good and
if you
so
tell, your
nice to tell.
impression will
Yeah,
be okay.
yeah, and the impression also from the examiner, like you are very careful, even while driving home, you are caring about that. So it's so impressive for me as examiner. Thank you, Dr. Aisha. So we can add it to any Breaking Bad news scenario. Whenever you close the scenario, you can offer driving home, as well as for procedure. After procedure, we can drive the patient home. So thank you, Dr. Aisha. It's very valid comment. Let's see Dr. Tanvir's scenario. Mr. Patel, Malika Patel, 43 years old. She's Asian woman who has been suffering from recurrent abdominal bloating and diarrhea. For the last 18 months. She opens her bowel around 3 to 4 times most mornings, and this is associated with crampy abdominal pain, which is often relieved by defecation. She has noticed some mucus in the stool. Her GP checked her blood, including iron, studies thyroid function, celiac screening, and organized an ultrasound scan of her abdomen, all of which were normal, of course. The GP mentioned the diagnosis of irritable bowel syndrome, started her on some Buscopan, but Mrs. Patel didn't find any improvement and requested a referral to specialists. The GP has mentioned in his referral letter that she does not have any alarming symptoms such as weight loss or rectal bleeding, and she has no other past medical history of notice. Your task to reassure Mrs. Battle the diagnosis of irritable bowel syndrome and negotiate the management plan with her. Clear scenario, Dr. Mayad, right? I will share it here in that chat box so all can see it. Dr. Mayad, I give you
Yeah.
1 minute.
Me, only one? Okay.
2, as
Okay.
you wish. Okay, I will give you 2 minutes. We can discuss the comments written in the chat box. Yeah, see, Dr. Tanvir is saying very nice actress. Of course, don't be judgmental. No smoking advice here. We discuss all these things. Job and impact, yes. Voice is not clear. I hope you can adjust your mic, Doctor, because Dr. Bakinam wrote your voice was not clear. I don't know, maybe earlier. The expectation, yes, Dr. Rashid. What about advanced directive and last power attorney? Yes, as we mentioned in the choking, breaking bad news, it's not preferred to us unless it's like an end of life. The palliative patient might live longer, so it can be discussed in the next meeting. Even if he's smoker, we will have secondary polycythemia. Yeah, this is
Dr.
as
Basim,
yes, Dr. Rashid.
regarding this smoking, in my experience previously, I have a patient with sorry, advanced mesothelioma,
Mm-hmm.
and it was written clearly patient for palliative only.
Mm-hmm.
Then I finish everything. Then I remember I advised the patient to a smoking cessation. At that time, examiner objected me. Let him to enjoy his life like that, like that.
Yes, yes. Yeah. I
And
agree with this
I'm
point,
keeping to
really.
say smoking is harm in any way. And he gave me full mark. I don't
Okay,
know.
so
He was just
he gave
he
you
was,
the comment feedback, but he gave you the full mark at the same time. So
no.
it's
At that time, we were discussing with a candidate,
okay.
and he was objecting. And then he advised me let him to enjoy his life like that, as he's
Yeah, yeah,
make
yeah,
some
yeah.
agreement.
Yeah. Really, for this scenario, I said earlier, no need to mention, but some doctors said if living longer for the palliative, so you
And
have
the
not.
renal cell carcinoma, when there is metastasis,
Yeah,
for sure, the patient for palliative. Nothing will be done other
yeah,
than
yeah, yeah.
palliative.
Because of metastasis, not only because of the cancer itself, because
Yes,
of the metastasis also,
metastasis
yes.
renal cell, nothing is there, only
Yeah, yeah. Okay, so if you can give a last decision for the smoking in this scenario, let it at the end of the after the breaking bad news and palliative therapy and social support, everything. If he raised the point, you can correlate to the smoking. If not, for me, I will not advise because already metastasized and everything worsened. So
let
what the
him to
benefit of
enjoy his
smoking?
life, yes.
Yeah, I agree with this. And now we know that this is the primary cancer here is renal cell carcinoma. It's not related to the cancer directly, to the
And
smoking,
I think
sorry,
as I
directly.
mentioned in this point, smoking is a scenario for this
Yeah, just
point,
to
maybe.
distract.
Yes.
Distract and to be as a trap.
Yeah.
Thank you, Dr. Rashid. Dr. Ahmed Areba wrote, even his smoker, he will be secondary polycythemia. Again, this is clinical point. It's not necessary to be explained, but to know it, yes, of course, he will be secondary to polycythemia due to smoker. Help to the Dr. Abdullah Hisham, help by referring him to multidisciplinary. Don't say him multidisciplinary, just say group of doctor and smoking cessation clinic. Okay, you can include it to the team. It's okay. If not, I guess it's not necessary to advise this patient about smoking cessation. Dr. Mayada, you're ready.
Yeah.
Okay, we reset the timer. Here you go.
Okay. Hello, morning. My name is Dr. Maida, one of the medical doctors here in the clinic. Can you confirm your name and date of birth, please?
Yes, doctor. I am Malika Patel, 43 years old.
Hello, Malika. What do you want me to call you?
You can call me Malika.
Hi, Malika. So just to confirm that we are here today to discuss some issues with your bowel. Am I right?
Yes, doctor.
Okay. So I have some notes here from your GB saying that you have a problem with diarrhea and bloating symptoms. How you feel today?
Yes, doctor. I feel actually still there is some pain and discomfort.
Mm-hmm. Okay. I understand from the GP letter, correct me if I am wrong, that you've been diagnosed with what we call in medicine irritable bowel syndrome. Do you ever heard about it?
Yes, doctor, somebody said like that, but I'm not well aware about that.
Okay. So can you tell me what's concerning you?
Yes, actually, I want to know actually what happened and what is the further management because they give me some medication and I'm not feeling beneficial actually with medication.
Okay, okay. And what do you expect me to help you? How to help you?
Yes, yes, I feel that this medication actually not enough, and I need to do more investigation, more scanning. I mean, maybe need camera tests to know actually what happened with me, because I believe this is not what they say irritable bowel syndrome. Maybe it's cancer or maybe something serious issue.
Okay, understand. Uh, Miss um, Camelia, from the notes and from the symptoms you are saying that irritable bowel syndrome, this is, don't bother by the name of this disease. It's a clinical way to say it. This when your bowel is get angry with and become more sensitive. Sometimes it will become more sensitive to food or medications or even emotional things. So it's become like you have these symptoms of diarrhea and bloating symptoms and the symptoms you are suffering from. This is what we call the irritable bowel syndromes. Uh, I think you've been done some investigation. This is investigation have been done already by your GB. Are you aware about this investigation have been done? Anyone discuss with you what investigation
Uh,
about?
yes, doctor, they did some blood test and some scan of my tummy, jelly
Mhm,
scan, and they said it's normal, but I don't know that if it's normal, so why I have
mhm.
this problem.
Okay, okay, I understand. So from the symptoms you having, there is, as you said before, you may have, there's several disease can present with similar symptoms. And what I understand that you are concerning about cancer. Okay. Uh, from the symptoms you have and investigation have been done so far, they did some investigation regarding your bloods and iron, the level of these minerals in your body called iron, and they did some investigation regarding your thyroid gland, and all this investigation returned back normal. We normally as doctors we do this investigation to understand how your body reacts if there is anything going wrong with these minerals and hormones in your body. If there is any wrong with them, this like indicator for us there is something going wrong. Are you with me?
Yes, doctor, I'm with you.
Okay. The good news is that all this investigation return back normal. That means your body is okay and you are not suffering from something serious at the moment. That's why at the moment uh, as our medical practice, when these minerals are normal, we are not worried enough to go further for investigation, like doing camera tests, putting a camera down in your through your throat or back passages to find out malignant. Sorry, cancer. Are you
Yes, doctor.
okay? So at the moment, we are thinking that all these symptoms may be related to this irritable bowel syndrome, the disease where your bowel is angry of something, uh, maybe food or other thing. Are
Okay,
you?
doctor, but you know that my aunt has similar problem. And initially,
Mhm,
doctor, they are thinking it's nothing. As you mentioned, it's everything normal. But later found their cancer. And
mhm,
later they did surgery, they did so many things. So I'm worried that maybe I have also the similar problem. Maybe I
mhm,
will develop cancer.
mhm. Okay. I'm so sorry for your aunt and what she go through, and I understand your worries, why you are worried and why you are frustrating, because you are worried that you may go through the similar scenario as your aunt. Am I right?
Yes, doctor.
Okay. I think now I am in a position to ensure you that at this time it's not the case, because normally if there is a cancer going on, sometimes this investigation normally detect something going wrong with your body elements. So at that time we can find out, and we ask ourselves to go further for more investigation. However, normally in our normal practice, what we are doing is that to weigh the benefit against the side effects of the procedure we are doing. And at the same time, we will not let you go alone. We will follow you in regular basis, so to make sure that there is nothing change during the period of time. We'll start give you some medications. We see how your body react to that medication, and if this medication is helping your symptoms, we stick to that one. And if it is not the case, we change our approach.
2 minutes.
We change our approach. Are you following me?
Yes, I'm with you, doctor.
So at the moment, as I said, waiting, putting that in way, benefit and side effects, we think that going further for camera test, because there is a perforation, I mean that where we can just insert a camera inside your throat. This is may go to wrong direction and causing it can cause infection. It can cause penetrating through the your tube and causing bleeding. So the bad effect of the procedure is overweigh the benefit, as far as we are okay with your elements and your body. And we sometimes the medication is not work enough, but we can change the medication to another one until we find a way that this medication act well with your body. Does that sound good?
Yes, doctor, but actually I want another opinion, doctor.
You want, sorry?
Another opinion from another doctor. I need opinion.
Okay, so this is your right. I can arrange another meeting with my consultant and with the gut doctor, so they will can discuss this further with you. But at the moment, is that okay to ask you some more question about your social life? Is that okay?
It's okay, doctor.
Did you smoke, or you ever smoke?
No, doctor.
What about coffee
Yes, I'm taking more coffee.
and tea?
Yes, tea and coffee I need to take every day 3, 4 times.
Okay, sometimes this disease, irritable bowel disease, uh, if you want to, if you are happy to me to use this term, normally it can increase, or the gut become angry more with this type of food and drinks like coffee and these things. So I found it good idea if you try to cut off your coffee and tea. Is that okay?
I'll try to reduce it.
I will give you some advice, written advice, and brochures that help you to identify type of food that is not working well with your gut. And I also arrange another meeting with my consultant and the gastro doctor. This is the gut doctor, so they will advise more in this instance. But in summary, let me reassuring you that IBS is not a dangerous disease, and at the moment we are not concerning about cancer, and we didn't think that it's a good idea to go further for a camera test. Does that sound good?
Yes, doctor.
Okay, can you briefly give me a summarize of what we are discussing now?
Yes, doctor. You said that my all the investigation became normal, and this is not something serious disease. There is a multiple issue can happen from this disease, like
Okay,
something mental
time
stress.
is up, already exceeding 2 minutes.
Oh, okay.
Yeah,
I,
thank you. Well, well done,
I
Dr.
will just
Mary.
ask about how this affecting her daily life, and I think I give her summary before I say that, but it's important to know how this affecting her life.
Yeah, yeah, you did great, by the way, you did perfect. I think if you have more time, you can do it. As you said, you will advise some related to the diet and blah blah. Let's hear Dr. Tanvir comment, please.
Yes, doctor. Dr. Maida, you did well. But some point you missed, just I will tell you, because it looks like IBS, I mean functional disorder, it looks like easy case, but when we are dealing still that during the 8 minutes, still you did not touch my social and other issues. So sometimes actually some cases we feel it's easy, but when we are practicing that time we feel that it's not like that easy. Anyway, first of all, that you ask, you introduce yourself. After that, you ask my name and date of birth. I think better to ask name and age instead of date of birth, because date of birth maybe sometimes it's confusing. Everybody are not aware maybe about the date of birth. So better to tell about the name and age. Second thing, you first explore about my complaint. What is the issue I came here? Okay, so you told that yes, you have some diarrhea and abdominal bloating, something. So diarrhea and bloating, especially this seems like something medical jargon. So you can tell in the other way, like lose stool, any tummy discomfort. I saw from your note you have some tummy discomfort, some loose stool. So better to avoid the jargon term. Okay, then you asked me that how are you feeling now? This is very good question because I am now something for chronic disease and I am not feeling okay with the medication. So you are asking me that how are I feeling now? So that time I said still I have some pain and discomfort. So in that situation, I need to actually offer that do you want any type of medication, any painkiller? I'll give you. So usually that candidate said, no need. Like surrogate said, no need. It's okay, doctor. But better you offer these things. And so after that, you explain my that IBS condition, irritable. So we need to explain that irritable bowel syndrome. Sometimes due to the some different issues, I mean sometimes due to the any anxiety or in the any stress in the family life, in the job life, sometimes due to the food habit and not properly sleeping, and sometimes due to the some bug infection that our gut or bowel become overactive. And sometimes like due to our brain give a signal something that it causes the overactivity of the bowel. So due to that overactivity, actually, it's feeling like there is some tummy discomfort, tummy pain, and also sometimes it's hard stool, sometimes loose stool. I mean that what is IBS and what are the symptoms and what you did. Already we did that all the investigation and even scanning and all are became normal. So you use one term frequently that angry bowel, but I think better to use that overactive instead of angry. Okay, then you initially, yes, initially you gave me little more information together. So better to give when you are giving some information, better to make a pause that checking that I am with you or I am with you like that. You later ask me that I am with you. You frequently ask, but initially you give me some more information. So it's sometimes difficult to absorb. Okay, so now after that, as I said, the most important thing that as you know that IBS is something like stress and something like the psychological issues. So you need to explore that can I ask some personal question with whom you are living? Is there any familiar issue there or what you are doing for living? Is there any problem in your job life? So I think you missed my ask what I am doing. So if you ask me what I am doing for living, I'll tell I'm teacher and I have some problem in my teaching life. So because this is very important, you have to rule out maybe with husband she has problem, maybe she's teaching or any profession, maybe she has problem in the job life with some other colleague. So you have to rule out this thing. This is very important. And smoking alcohol, you asked me, and also how much it's affecting my daily life. That is another important question. And here my concern is that I said that my aunt having skin problem, and doctor gave me the same treatment. I said it's not serious. Later it's found the carcinoma. So I want to go for a scan. Yes, you explained me about that scan. It's actually now not mandatory. Moreover, it will cause some harmful effect. That time you use some jargon. I mean perforation, penetration. So you can tell like this way that it can cause some injury, can make the hole bleeding and even infection. Perforation penetrating is actually jargon term. And why you are not going for that scan? This is the very important thing. You already explained that scan, what are the risks of the scan, but why you are not going for scan? Because here mentioned that GP don't found any alarming symptom. I mean, not found in the weight loss and rectal bleeding. So it's supposed to be, you already mentioned that, yes, I'm appreciating your concern. Actually, you are thinking for the cancer, but what you found in our investigation, actually all the investigation became normal, as you mentioned. But later also you need to mention these things, and actually due to the cancer, there is some symptom develop, like patient gets some lump and bump, weight loss, some bleeding through back passage or through the mouth. Actually, for your case, we don't found this type of the feature and it's mentioned here. So you have to mention why you are not going for scan. So that is another thing. I mean, you have to explore. He don't have the red flag. Okay, then you need to ask female at younger age, so you can ask some female history, like what about the period, are currently pregnant or not, like simply taking any OCP, like female history as female and younger age. So you need to ask these things, and later you can ask about any other more concern and leaflet, brochure, and contact number. You can contact us anytime. And the good thing that you said that yes, we are regular follow-up with you. As patient, the main thing is concerned about the cancer. You said is nicely that yes, we are regular follow-up with you to check your any symptom. And another things you nicely managed that I want second opinion. You said yes, we will arrange the meeting by consultant. That is your nice answer. So that's all my comments. Thank you, Dr. Maizar.
Okay, thank you, Dr. Tanvir. Very nice scenario and very high yield topic, either IBS as IBS or as function disorder as a general term. Let's start the comment as Dr. Tanvir said, it's not birthday, it's the age. Okay, and the patient name, you ask her how can I call you? She said Malika, and in the middle you mention another name. I think you said,
Amelia. He said
yeah,
Amelia, yes.
yeah. Okay, so be sure about the name, or you can say Madam. If you are not sure, don't look at your paper, just say Madam. Okay, better not to mention wrong name and not to look at the paper. It will be considered like you are not focusing. So Madam or Sir as a general word for both genders. The second thing, you start to enumerate her symptoms by yourself. You didn't give her a chance to talk and to open up what she has. She came here to to talk with you, not to listen to you. I prefer to make it conversation way. So, how are you, Malika? You are okay? Let me know what you are suffering from, and let's share the ideas together. Rather than saying, I noticed in your letter that you have bloating, that you have. So she need to talk, right? Let her talk about that. The background is better to be mentioned by the patient. She will feel like she talk with you, not as a question, do you have, and you it was written in your paper. So why she came if you will do everything by yourself? The expectation, okay, you did. Apart from that, I want to know why you choose the colonoscopy to talk about. I read the scenario twice, but she didn't, or the scenario didn't mention any endoscopy or colonoscopy.
No, patient ask, can I
She
go for
asked,
camera test? Yes, she asked.
okay, yeah.
Yes, yes, I
Okay,
asked.
yeah, okay. Because it's the two details that waste the time, and because of that, you miss the social support and the job. And if she asks particularly about something to be done, you can say it's in one sentence. We are not doing usually the advanced test. As you said, always we are outweighing the risk and benefit. And once we have the risk outweigh the benefit, we are not going through it. Okay? And try to give time for the support. Social history is very important here to ask about the job, the family, because it's always there is hidden agenda about the trigger. It's not the matter of organic cause. So we will not go with the procedure or scans or whatsoever. We will try to address your concerns, your stresses, and we will try to manage them. And in this way, we will control your disease. So I prefer to ask these things. The most or the embarrassing here in this scenario, when you ask about caffeine, which anyone will never remember it, caffeine and tea and diet. But in the same time, or at the same time, you didn't ask about the sleep, the mood, okay? So try to address all together, not only caffeine, without mentioning the other triggers. But it's okay, you did the caffeine and the diet. Also, you can refer her to the dietitian to sit with her in another meeting. The job is very important. Sometimes, as Dr. Tanvir said, it will be the hidden agenda. Her job is putting more stress on her. So you can offer her some relief from the job, to take a vacation, to rest at home, to sleep well, all the things. If you addressed it, better than talking or negotiating for the procedure. I know Dr. Tavi also went more with the procedure, and she want to be sure about it's not a cancer, but try not to give more time for the things it might waste your time. You got it, Dr. Mayada? Because you
Yes,
miss a lot of
very
things.
nice
Yeah.
comments. Yeah,
Yeah, but you are
yeah.
very fluent, but I need it from you just to give him time to talk. The surrogate, I mean.
Mm.
Try to be like answering, not questioning. You are the one answering and addressing. I don't want to prefer to be a questioning doctor. So you are not here to ask here. No, we are here to listen to you, and I will address every concern. And at certain times, I will ask you, whenever you hear 2 minutes left, this is the time to do your support, to ask about smoking, alcohol, job, driving. 2 minutes just to remind you to do the last two or the closure of the meeting, which is support, who's living with you, social, and if you have time, you can give red flags. It's very important here, as she's worried about cancer, to end up the scenario or the time or the session with some advice regarding the red flags. Please, if you feel very severe tummy pain, pass some blood in your stool, or loss of weight, please seek medical advice urgently.
Yeah, this is very important and very nice. Yes, yes.
Yes.
Yeah, because yeah,
Yeah.
In fact, nowadays they are concerned about these things. Even when you're discharging the patient from the hospital, you
Yeah.
need to give
Yes.
him this
Perfect. Safety netting. Yes.
netting. So yeah,
Yes.
very important. Yeah, I
Perfect.
feel I miss a lot of things. In fact, by myself.
Yeah. In fact, it's like several time training and practice, and it will be much better in the next time. Because the first time you will miss, the next time you will try not to miss, the third time you will not miss. Okay?
I have
Yes,
a word
I,
to you, Dr. Mayada, if you don't mind.
Yeah, Dr. Aisha, go ahead.
You are very, mashallah, very impressive your way. Just as I said, always be simple in communication. You explain a lot of things. Maybe he is a patient not interested, or he know because he already diagnosed by irritable bowel. So ask the patient, do you know what you are diagnosed? And also, if you ask him if you know or no, even if he need to explain more, just be a simple. And even when you try to explain the way we will treat, I think you take also a lot of time because this you missed a lot of point more important. So just be simple and not tell the patient all things, just what he need to know, what concerning, what coming for today for you. He is concerning, has concern mainly that he is having other things. So he is not very concerning about irritable bowel, what is mean, how we will treat, like that. He is worried that to be another things. Maybe if he tell you I take medication and I'm not improving and my cousin has the same things and it is at this time you can explain also by more simple way that we have type of medication and it is steps we can move on with other steps and we will not leave you alone, we will follow up you regularly and be close with you, like. But if you explain more with details, it is very good. I like the way you explain this to you. This is very good for the patient if he need more information. But just it is may leave you no time to explain the important things, like in this scenario about the stresses in life and support and follow up and how you will manage her symptoms, like that. So I think you are good, very good in presentation, in communication and in sympathy. Just be more simple and don't get a lot of details during explaining things. Just be like what he need to know. If he didn't understand, you can explain more. But if he is okay with irritable bowel, and you can skip all these points. And also, as Dr. Tanvir said about, you said, I think, I don't know what is you called, but it is better to be overactive or not angry. I think the word is not like common for us, or not like judgment about the, yeah,
Normally we say like this, like if you have diarrhea, we say like your bowel is angry. It's something I don't want to say, but they love the things
the
action.
extreme of expressions, not good really in life usually, or in communication especially. So just overactive, I think, may be more suitable, better. This is
But
also my
it will
opinion.
not
I don't know
cut,
if it
yeah,
is.
yeah, it will not
Uh,
cut the mark if she said your bowel is angry. It's angry
They love,
because you're
in
angry,
fact,
reacting.
English people, they
Yeah,
love this type of
yeah, yeah, it's okay. For
scenarios,
me,
like
it's
angry, that look, something like that. They
and
love
if
this
it's
type
not
of.
the bowel itself, it is the brain that it is
yeah, the brain.
wrongly
Yeah,
interact with stimuli with way, because we the irritable bowel not the problem in the GIT, it is neuro GIT axis. So
But you
I
are
don't know.
right. You are right.
Mhm.
I need to be concise. Yeah.
Yes, so small, simple, because you have no time to explain in details all things.
Uh, Dr. Basim, uh,
yes, go ahead.
okay. So I heard this scenario with one mentor before. and about the same concern that the surrogate raised, that is it cancer? He said one word, that irritable bowel syndrome never cause cancer and never go to cancer. And that's why red flags are not crucial here. So I checked the NHS, as I am doing always. So it is written clearly here, IBS doesn't pose a serious threat to your physical health and doesn't increase your chance of developing cancer or any bowel-related conditions. The exact cause of IBS is unknown. So when you are describing IBS, we should say that the same thing written in HS side, that it is of unknown cause, but it is overreacting of our GI system to some certain food or mood, emotional, as Dr. Mayada said. And when the surrogate said that I am afraid that it's cancer, my aunt diagnosed with cancer, we should say that you have irritable bowel syndrome, and the scenario actually helped you by mentioning that there was no alarming symptoms. So you don't have any alarming symptoms. Your basic investigations and the investigations which is done normally to exclude cancer came clear. That's why we don't think that it is cancer. And maybe your aunt, she doesn't have the diagnosis of irritable bowel syndrome like you, because in your case, irritable bowel syndrome will not turn into cancer, and it is different than cancer. I don't know, what do you think about that? And the red flags in the end should be lifestyle modification only, not mentioning that if you have bleeding the rectum or something, because this will never happen in this case. Just you will tell that you need to make some lifestyle modification. And like Dr. Meda, I like the sentence, what she said, I will give you brochures to read more about the food that might trigger your symptoms, and also adding that we in the management plan that we will, a group of doctors will take care of you, including the dietitian. I don't know, what do you think about my comment?
Yes, there is a lot of opinions regarding this scenario. I did it with some also mentors, and she offer yoga. You know the yoga, even you can offer it. Yeah.
Yes,
So
same mentor also offer yoga. Same
yeah.
mentor also offer yoga. Yeah.
So it's a matter of how to address the stressful condition for her life. And as you said, lifestyle modification. I agree with this. The cancer, there is possibility there is, but if you mention the red flags, so forget about it. It will never, but it would be cancer one day, but it's not the time and not the symptoms, as Dr. Meda did. For what else you mentioned? So the cancer, and
Because if you
perforation.
mention the red flags, you will put the surrogate into the
No,
beginning. The surrogate might tell you, so it might be, it might
yeah,
turn
no.
cancer again.
Because she's worried, and I have to give her red flag. But this is at the end, not in the middle or the beginning. I will say it at the end, before ending the session or the station. Okay, after the social support and lifestyle modification and dietitian and the teams, before ending, please, if you feel abnormal feeling, because cancer, if family history of cancer, I have to think about it in the future. It's not rolled out, so it's my time to give her some red flags. It might be one day a cancer, and it will come back, or she will come back and will blame me. See, it's a cancer. I told you it was a cancer. No, it wasn't a cancer.
Yes.
So yeah, you have to put it in the mind whenever
Yes.
you are closing the scenario. You have to do it.
But Dr. Basim, I thought
Mhm.
you read this while she told her that her aunt is having cancer. Okay,
Uh-huh.
that time we have to reassure her with these things. Okay,
Yes.
this cancer, it will have red flags. Okay, it will have like some signs, and we have to check if there is weight loss and bleeding per rectum and all these things. we have to tell her immediately when she asked her concern, when she told her concern. Okay,
I
I think
agree. Yes, I agree.
at that time we have to tell these things.
Yeah, if you do it early, it's okay. If you didn't, you have to give it at the end as safety meeting.
Yes.
Okay, either here or there. But you
Mhm.
have to give her this because she give you alarm sign. Family history itself is one of the alarming sign,
Yes,
apart from the disease.
especially in the bowel cancer.
Perfect, yes, perfect. Perfect, good discussion. Thank you, Dr. Maha and Dr. Salma. All of these ideas make us more open-minded for the addressing the concern. So it's good to know and good to discuss it and loudly as we did. And if you face this scenario, definitely you'll do it in a perfect way. Any comment else? Dr. Salma also wrote earlier, I think diarrhea, not jargon. Agree, somehow you can say diarrhea, but
In
if you
UK,
said loose
I believe
motion,
in UK only.
in UK everything is accepted, not only diarrhea.
Acceptable, yeah. But in
Yeah,
our
in overseas,
exam,
no. Yes,
yeah, in overseas, it's a
exactly.
jargon, definitely.
Yes. Okay, but asking about her background, yes, as I said, so you ask about background to save the time. It will be more helpful to save a lot of time. I think, yeah, Dr. Naila said, yes, patient concern, yes, right time management, exactly, it's important, yeah, and it will be better in the next times. Who share this figure? Dr. Maha, please, if you can share it to the group, or I save it already, so I can save it, I can share it later.
Okay, so
Dr. Tanvir also titration and mood, doctor. Yeah, if she mentions something related to her mood, you have to refer her. If not, you can mention him in the group of doctors. Okay? Any question else? Any comment before ending the session? So again, thank you, Dr. Mayada and Dr. Tanvir for the practice today. Thank you everyone for sharing the comments, writing, or verbally. See you tomorrow, inshallah, with clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
thank you so much. Alaikum salam.
Most welcome. Thank you. Most welcome.